Hello, everyone. This is Ana Maria Tirano, Vice President of Marketing at Synzi. Welcome to today's webinar presentation, Why Your Agency's Culture is Critical to Surviving and Thriving Under COVID-19 and PDGM. The presentation will highlight how agency culture and technology has helped two agencies, Concierge Home Care and Aspire Home Health and Hospice, evolve from old to new home health care. Today's presentation is being recorded, and the recording will be sent to all attendees and registrants later this week. All participants are muted. If you have a question, please use the Q&A tool in the webinar platform. We will respond to the questions at the end of the webinar. We are pleased that Linda Murphy of Concierge Home Care is able to join us today. Linda has been in the healthcare arena since 1987. She started her career at the University of Florida as an ER charge nurse for 15 years. She discovered home healthcare as a field nurse in 2003 and the true difference that she can make taking care of someone in their home. She spent the next 12 years working for Almost Family, a large publicly traded home healthcare company. She assumed directorship of a small agency in Gainesville, Florida, where she was able to develop and implement many programs that bridge gaps in care as she saw them, including an in-home palliative care and oncology program. She continued to expand her leadership role and in 2015 was responsible for sales and operations of 31 offices throughout the Florida market. In June of 2015, she had the opportunity to apply all that she had learned in the post-acute arena as the CEO of Concierge Home Care. Currently, Concierge has offices throughout Florida and in 4 years has become one of the largest providers in all the areas that they service. Their reputation as innovators and delivery of quality outcomes has allowed them partnerships with all their local hospitals as preferred providers. And Linda has been involved with multiple bundling projects, ACOs, and initiated several pilot programs that have yielded reduced rehospitalization rates while optimizing symptom management. She's been published multiple times, and she's spoken on behalf of home health quality improvements for best practices to improve patient outcomes. She lives on a horse farm with her husband, Chris, of 32 years, and is the mother of 3 amazing boys and is getting ready to adopt a 4th. She proclaims to live her life to the fullest each and every day. Thank you, Linda, for joining us. We are also joined by Chris Carter, CEO and owner of Aspire Home Health and Hospice.
Chris Carter is a cutting-edge thinker. She is continually studying the marketplace trends in other industries to find ways to improve the delivery of home health and hospice care. She is an early adopter of telehealth and seeks ways to improve patients' care at Aspire Home Health and Hospice, where she is the CEO. Some of the innovative telehealth programs which have been implemented at her agency are virtual therapy visits, COVID-19 infection control and education, diabetic care, and a CHF program. Chris's long-range goals is to use technology to work smarter instead of harder.
I will turn this over to Linda to start to talk to us about how her agency is continuing to deliver valuable and safe care amid COVID-19.
Absolutely. So we have actually been very fortunate to be working with Synzi since October of 2018. So we had implemented and really had a great process in place already. So when COVID-19 came through, it was amazing that we could instantly connect with actually all of our current patients that we have on service, but also with any patients that we've seen in the past. So instantly we were able to push out text messaging and education pieces to over 10,000 patients with any given time. We were actually able to start increasing our virtual visit count. We immediately started adding some additional virtual visits for all of our patients across the region, and actually had the ability to touch some of the patients. As we saw in Florida, a lot of our assisted living facilities were starting to close their doors, one to our therapy teams, but also to some of our nursing teams. So it was a way that we were quickly able to get some iPads into the buildings and actually still reach out and touch our patients. So it's just really from a COVID-19 perspective. I had no idea. I feel like we have really accelerated our virtual care ability. What we've worked on for almost 18 months, I feel like we have done more in the last 30 days than we did in those first 18 months, because now we have a community that was really wanting and looking for some options. So.
Chris, from an Aspire standpoint, what has your agency been focused on amid the current pandemic?
Our primary focus has been keeping our nurses safe and being able to still deliver a real quality of care. Aspire started using Synzi about 9 months ago, so we're not quite as advanced as Linda's team in using it. We are a smaller agency in Utah, but right away we could see the benefits of being able to use Synzi to be able to remote into a patient's home prior to our going out there to screen if they had any COVID signs or symptoms. Also this last month, Utah was rocked with a bunch of earthquakes as well as the COVID virus. So, we were able to use Synzi during the earthquake as well to be able to keep our nurses home and to be screening to make sure our patients were safe. And we actually had a nurse at home helping a patient in an emergency status in the middle of an earthquake while she sat home underneath the table with her children. And so she was able to stay safe and keep a patient safe. And it was just such a quick and easy way to implement our emergency preparedness plan through Synzi. And, we've not been blessed to have a lot of protective equipment in Utah. We're about 3 weeks behind some of the other states with and getting supplies. We've had a really hard time. So one of the things we've been focused in is making sure that our nurses have what we can. We started a sewing bee to make sure our nurses get the protective masks. We've come up with some creative ways. And the community's been great to help join in that. And another thing that's really, really critical to me to help our nurses and our frontline staff get through this pandemic is to emotionally support them, reaching out through them and making sure that their families are safe and they have what they need. We've set up a food pantry in our front lobby so that if nurses are so tired or CNAs are so tired that they don't want to go to the store of risk of increased exposure, they can just grab food in our front lobby. We have supplies, including toilet paper. So just really making sure we're taking care of everything, their physical needs, their emotional needs, and supporting them in being very safe at this time.
Yeah, I would also like to add, likewise with us, we being able to have that connection and contact. We've even been able from day one to send out messages with links to videos, especially from the World Health Organization. We were pushing weekly messages to both patients and our team members with the valuable education and timely updates. We've been deep in the midst, we have about 500 team members, and fortunately to date, none of our clinical team has tested positive for COVID-19, even though we started accepting patients with COVID-19 several weeks ago. So we anticipated and we saw immediately where some of our patients were starting to say, I'm not sure I want a healthcare worker coming into the home, and started pushing back a little bit for some of our visits. But we did see quickly the ability to still hang on to those patients till they felt safer, and they were actually requesting to participate in the virtual visits. So as we all know, even though those virtual visits aren't reimbursable at this point, it does get us the ability to keep those patients, make sure they're safe, and make sure our staff are safe.
Linda, how would you define the culture that you've set up and that you've strengthened over the years at Concierge Home Care?
Well, since we established, and as I mentioned earlier, we're really still in our infancy as a company, at 4.5 years into this. But, our mission statement was, I started my life in home health always thinking you do the right thing by the patient and everything works out well. But as I started our own company, it has always been a servant leadership platform with people come first. And our motto is we take care of people taking care of people, because when you take care of those team members, they take good care of our patients. There's so many different values out there, but we try to live and incorporate our values into everything that we do on a day-to-day basis. So integrity and, having the courage to meet the demands of reality, caring, encouraging the heart in every aspect of what we do. Quality, and when we talk about quality, we're always challenging the process. How do we make it better? Service, and enabling others to act and be the best that they can be. And then innovation's a big one for us, and it's overcoming challenges. So we are early adapters to a lot of different innovations, and I think it is one of those pieces that sets us apart, as well as attracts like-minded team members that really want to be part of something that's bigger than themselves. And then, of course, our team comes first in meeting the needs of our people, and that way it allows them to meet the needs of our other team members. I sit here and I think about an example when I look at culture, and I always I've got a story that I think it brings to light when I talk about how we want to develop a team that digs deeper and looks for the real issues and how can we really make a difference in a person's life. And it always brings me back to a patient that we had been referred to us for occupational therapy because the family was having difficulty with him bathing and bathing with the patient. So my OT went in, and we've always believed in using some type of standardized tool. So of course we use the MoCA to determine the level of dementia for this patient, or confusion, and of course it showed severe dementia, but this patient was still able to read. So our OT, went in and started working with sequencing, which I'm sure a lot of folks on the phone are aware of, but was able to get this patient independent with brushing his teeth. When you use sequencing, you can laminate a piece of paper and say, get toothbrush, turn water on, wet toothbrush, put toothpaste on. But you can walk a patient that has some dementia, if they can still read, and allow them some functionability and give them the ability to do it for themselves. So she did this, and then she did the same thing with bathing, got the right little bench for him so he could get in and out, and had little laminated sheets in the bathroom so he could simply bathe himself. So we're at the end of the episode, and she's getting ready to discharge the patient, and she's asking him, did we meet all of his goals? And he still has his head kind of hung low, and he says, I'd really like to get to the boys. And first thing she's thinking, oh my gosh, what part of hygiene did I not cover? But when she further asked him, he wanted to get outside of the house, and three lots down, the older boys in his neighborhood would gravitate together, and they would play cards in this open lot. So we were able to get physical therapy back in there and built a ramp for him to help him get out of the house. And this proceeded for a couple more weeks. And then, of course, we go to discharge the patient, and this therapist does a repeat MoCA to see what level of improvement we've had. And I always ask everyone, what do you think it showed? And of course, everyone says improvement. Oh, there must have been improvement. Well, it showed zero depression. Zero dementia. It was all depression. And when you don't take the time to really understand the patient, and the typical agency would have just gone in there and put in some grab bars and shown a patient, and the family members how to bathe the patient. But sometimes just taking that extra time to really make the difference, that's what we try to do on a day in, day out basis.
Linda, thank you for sharing, especially that story, because it really brings concierge values to life and how you hire people who share that similar mindset. Chris, can you tell us about the culture that you've been able to develop at Aspire?
Sure. You know, we have the same things of our integrity and always wanting to be innovative and looking for, you know, quality, service oriented, being an early adopter in our marketplace of using Cinzy. But really, for me, service always reflects leadership. And, you know, I view myself that I'm really here to serve my team and to ensure that they have everything that they need. And, you know, I had one of those really face down moments about 4 years ago when I found myself so incredibly burned out that I couldn't come to work hardly, and I could find no joy. And, you know, it was really interesting when I look back, I look at where our agency was and how far behind we were on notes, and a lot of customer complaints, and not good, sometimes good delivery of service. And, you know, it was just such a miserable place to be in. And one night my husband asked me, well, what is it that you really want? And I said, I just really want to be happy. And I realized what was missing was that I had stopped serving others actively like I had done in the past. And so I went out on a mission to be able to find someone outside of my normal circle to serve every single day. And what happened was because I decided that I was going to be happy by serving others, it kind of caught on in our office, and that other people wanted to have that same happiness and that same endorphin hit from being kind to somebody else. And it caught on. And we determined we would set out and count how many random acts of kindness we would have over the year. We thought we'd maybe achieve 7,000, but it turned out to be such a big community movement of being kind. And we ended up doing over 40,000 random acts of kindness outside of what we would normally doing as caregivers. And what really was interesting was that I learned that being kind also means being clear and setting clear expectations. Being unclear is unkind. And with that, our organization really changed. We went from having a really high turnover rate to being one with no turnover rate. We've been able to deliver much excellent care. We're able to implement our QAPI programs, and it has actually turned around our organization. Really, the foundation of our team is kindness, and that even means saying extra things in emails, thanking people and expressing gratitude to other people. And it's amazing how the culture reflects what the leader is working on themselves personally.
Chris, thank you for sharing that story and also bringing to life how the culture of kindness exists throughout all the agency's actions, and that it's obviously something that keeps everyone together as well as makes them hopeful within this time of the COVID-19 pandemic. So what's very interesting is when I spoke with Linda and Chris a couple weeks ago, and this is actually pre-pandemic, both of them used the term servant leader. So I thought it would be very helpful for both Linda and Chris to explain their own take on this particular phrase and what it means for them as servant leaders, as well as having a culture of servant leadership throughout their agencies. So Chris, we'll start with you. How do you define servant leadership, and what does it mean for your agency?
It means that if my employees know that I'm here to help them achieve their own highest potential, and that as a leadership team, we're here to help them have the right tools so that they can be successful and that they are part of a larger organization. We're working for the greatest good. Our nurses and our frontline staff are our biggest asset. And I cringe when I hear stories of how nurses and frontline staff are treated in some ways. And these people these are our most valuable resource. And we need to make sure that they are so supported emotionally and physically. And so my job is to serve them. And I just don't know how else to put it. Making sure we have the right kinds of communication, we have the right kinds of tools in place that they can help see the vision of where it is that we need to go as an organization, that we're transparent in the things that we're doing, that we're supporting them. One of our favorite things to do is to write a thank you note to our employees from our management team. We'll stick it in the mail and it will be mailed to their homes personally. And there's been so many people thank me for receiving just words of encouragement and thanking them for doing their job and doing it well and going up and beyond the extra mileage. And that makes your team more willing to serve and take care of the patients for us. It creates a common good.
Linda, you also use the term servant leadership. How do you define it at Concierge in terms of your own leadership style?
We based from day one, walking out the doors and starting our company off of servant leadership, and that everyone is a leader. We really kind of even define it down into what are those qualities that we're all working towards on a daily basis. And, so it's valuing diverse opinions, cultivating a culture of trust, making sure we have a commitment to grow our people, that, there's an awareness, not only an awareness around, but a general self-awareness, especially self-awareness. And we use predictive index and some other tools that we do to strengthen everyone as a servant leader and better understanding how you get the best out of everyone that we're working with. We have and it's not, a true servant leader says, let's go do it. It's not you go do it. That there's empathy, to really understand and empathize with others. We seek to convince rather than coerce compliance. We think long term. We nurture great dreams and don't be afraid. The ability to look at a problem from a conceptualization perspective, meaning that, one must think beyond the day-to-day realities, but what's the long-term solution here? Foresight, is a characteristic that enables servant leaders to understand lessons really from the past and the realities of the present, and likely the consequence of a decision in the future. It's just deeply rooted in the intuitive mind. Also that we act with humility and that we build a community of stewardship. So all of those pieces come together, and it's so interesting. A year and a half ago, as I'm sitting here, and I think even from a foresight perspective and implementing, our virtual visit platform, whoever thought or even knew that the coronavirus was coming? And all I can say is thank goodness that we, as a group of leaders, really, we were trying to look for a solution on how we could reduce rehospitalizations, and had no idea at that time it was really going to help us with the rollout of PDGM, and then tenfold help us in dealing with the pandemic that's facing us and the challenges that we have right now. I just think we're way ahead of the curve in being able to answer the challenges that we're being faced with.
Thank you, Linda. So both agencies Concierge and Aspire both use virtual care, and it aligns with their agency's culture. So much like Linda just alluded to, at first, many agencies were considering and implementing virtual care and telehealth apps to address the challenges faced by PDGM, but now it's become much more critical given the pandemic that we all face. So when we talk about virtual care, we usually use also a term called telehealth. And telehealth, we're listening to everything that CMS is telling us, HHS, the relevant home health state associations, et cetera. And it's a hot topic of the day, right? It's emerged as an umbrella term for the broad range of technologies and methods which are used to deliver virtual medical, health, and education services for patients, as well as the providers who serve them. The key word being virtual, that telehealth-related tools and technologies are designed to provide care in a virtual manner. And at Synzi, our virtual care platform enables agencies such as Concierge and Aspire to use HIPAA-compliant secure messaging, text, email, and video for their clinician-to-clinician and clinician-to-patient communications. So you can see that there's a couple ways that the agencies use it today, especially amidst the pandemic. One is conducting virtual visits and virtual check-ins with their patients, also providing them with condition-specific messages to drive adherence, and last, in this time, to give them updates about COVID-19 and also notify them of any emergency situations so that the patient communities that they serve are prepared as well as they can be. Linda, talk to us about how virtual care fits into the type of care that your agency has been able to deploy, especially in the past 18 months, but even more important in, say, the past 2 months.
Yeah, absolutely. It's become, it had already become a part of it. So every single admission that we do, we look at where we can place in some additional virtual visits or replace some in-person visits. And, I look at it, honestly, I think the easiest thing is I was on a call. We're doing a daily 4 o'clock call right now with all of the management team on COVID-19. So that's where we put out all of our education updates in a daily Q&A. But yesterday, we just discharged a patient that had COVID-19 that we've been taking care of for a couple of weeks now, and he was a 53-year-old gentleman that had come down to the St. Augustine market here in Florida for a conference, and lo and behold, he got COVID-19 and was very, very sick, was discharged from the hospital, but he was here all by himself. He had no family. His family was up in Michigan, and he's been here for 3 weeks trying to get over the complications that had occurred as well as the COVID-19. We actually received a call yesterday from the hospital case management, head of case management, and even from the patient themselves. It was the last visit our nurse was doing with him, and he just had his second test that showed that he was COVID-19 negative so that he can return to Michigan. We've been working with their health department and our health department to be able to get him back home. And this gentleman cried and said he had no idea what he would have done without that. We were there every single day with him, because on the days that we weren't with him in person, we were able to be there with him virtually. So Synzi really is, it's a care communication platform which enables us to use that HIPAA compliant secure messaging. So even though there's been some lessened requirements to allow virtual care to happen, I feel very secure because our messaging is very, it's secure, it's compliant. We email, we video for both our clinicians, and we have clinician and clinician to patient communications. Another really neat thing for us to do is it allows our clinicians to text messages to their patients even before they're going. So even when you think about from a communication perspective, one of the number one complaints, if you're looking at your HCAP scores, and I'm sure every agency is very similar, is communication. And a nurse forgot to call me that they were coming out the day beforehand. And we require all our staff to call our patients the day before. But once I rolled up Cindy, my clinicians now can send a quick, takes them 5 minutes to text message all of their patients for the next upcoming day, what time they'll be there. So we do like a 2-hour window, but it allows them to just quickly communicate with their patients. Hey, I'm going to be there tomorrow. I'm going to be there between that 12 to 2 o'clock window, or wherever that piece is. So again, from a communications perspective, our patient satisfaction has increased tremendously. Throughout the episode of care, home health agency, we engage the patients with video-based virtual visits because they can also connect back to us. I'll give some additional examples that we use Cindy for after hours. All of our infusion patients, it's one of the first things that we do to get our patients set up for virtual visits. And I was just listening last weekend where we had a patient that was having difficulty, and the nurse was able to walk them through their SASH method in delivering the infusion, and the patient had their little clip locked on their IV tubing, and that's what was stopping the infusion from going. And it saved my nurse the 45-minute drive out to the east coast of our area and 45 minutes back that we would have had to done before, because it's very difficult to talk a patient through that. But when they can hold up that phone and you can actually see what they're doing and be able to address the problem right there and then. So it just gives us a really better engagement, better outcomes, and better bottom line. And especially has helped us thrive underneath PDGM.
Thank you, Linda. Chris, can you tell us how you're using virtual care at Aspire above and beyond what's happening right now with the pandemic?
Well, a lot of my focus, even right now, is looking to the future and continuing to remind everybody that this COVID is temporary and this too shall pass, and that we got to keep our eyes on the really big picture. And the big picture is that under PDGM, we have to be able to ensure we're delivering an effective care that is touching our patients and helps them to be as most independent as they can, while making sure we're delivering at a good cost point, and that's by the use of technology. We also have, coming down the future, a huge age tsunami coming, where the demand for home care and hospice care is going to be greater than the amount of nurses that we have. By able to use technology, and like Linda was talking, being able to save our nurses from driving 45 minutes to take care of a 15-minute visit and then another 45 minutes. We need to learn to work smarter and not harder. And that is through the use of technology. By being able to look in and help a patient, we've started using, right now under COVID, but this was part of my long-range plan, was to be doing therapy visits through virtual. We've been under PDGM, physical therapy visits have been limited. And so being able to virtual in, we started doing this earlier in the month of March, so that we could help patients still maintain their activities, their exercises, their home exercise programs. And under COVID, we had a patient who just recently had a stroke. And because of the fear of the virus, she was not allowing even the physical therapist into her home. We were able to use Cindy, and we still are, being able to connect with her virtually and helping her do those required exercises, because she's in such a critical stage in her recovery that if we don't get virtual in there, there's no other way we'll be able to get her the help. And so being able to follow, her home virtually. As an agency, we've been looking at innovative ways to be able to look at other populations who may be hurt under the PDGM changes. One of my focuses has been, how can we serve the diabetic patient? And as an agency, we have developed a diabetic program using our technology, the virtual care. And we're able to help support diabetic patients at home. And so I think we have to look long range. It's really easy to get caught up in the short game here of the COVID, but we need to really look long term. I look forward to the many opportunities that COVID has brought us to demonstrate the value of telehealth, and especially in home care, being able to show the cost savings, the efficiencies. I think this is really a prime opportunity to maximize the value of the virtual care.
Thank you, Chris. And before we turn it over to some Q&A with the audience, some final tips and thoughts from both of you. Linda, let's start with you and some concluding thoughts from Concierge Home Care in terms of bringing virtual care and servant leadership to life.
Absolutely. One of the things we rolled out this past year is, again, when you want to take care of people who take care of people, is we wanted to make sure that every employee on our team was on an incentive plan, and have the ability to really reward those high performers and have a plan. It took us about 11 months to actually create our incentive plans. That was meeting week after week to make sure we were able to incorporate our values, our beliefs, as well as the outcomes that we were trying to drive towards. The plan included elements, culture, accountability, and performance, and we wanted to drive the right actions, behaviors, and outcomes. We use a quarterly incentive plan for our clinicians in the field and a monthly incentive plan for most of our administrative teams. An annual performance review I felt was really insufficient and really did not produce, the level of detail and engagement that I really wanted from each and every member of our team that makes us who we are today. So it has to be a living, breathing, and constant conversation about the plan. And it really forces that proactive management. And it's amazing how much your team members feel when you have a sit-down meeting with each of them on a quarterly basis. It makes a huge difference and forces that communication that needs to occur, because everyone really wants to do a really good job at everything that they do and be the best that they can be. So, virtual care is a strong initiative, and we've been using a separate measure for this item for 6 months. Virtual care seems to be embedded into our day-to-day actions, and it's become a DNA of our culture. At this point, I have a phenomenal team leader that manages my virtual care team. And without her, I don't know where I'd be today, but it's been just amazing to watch this team grow and to see our rehospitalization rates finally making that move and decreasing again. We talked for just a few minutes when I heard Chris talking about therapy. I'm very fortunate to have a wonderful therapist on my team that actually rolled out our virtual care team of therapists as well. And believe it or not, we did our first, this was back in November, we did our first total knee with 3 in-person visits and 3 virtual visits. Now, he's a younger one and didn't have all the comorbidities that a lot of folks had, but I will tell you, we were sitting and meeting with one of the largest orthopedic referral sources in our market that was getting ready to sign a deal with a virtual therapy group out of California. So we live in Florida, so you can imagine where he was going to, in his bundle, do nothing but virtual care for therapy for all those patients. So it's definitely a different thought process, but it's amazing what you can accomplish when you still have that face-to-face recognition. So just a couple of final ideas. I've never looked back, and I never thought we'd be sitting where we're at today, where virtual care has become probably one of the biggest topics, even on every call with CMS and ACA and health plan that you work with. It's funny, their first question now is, do you do virtual care?
It's amazing how virtual care and telehealth are becoming more and more widely understood, and also sparking a lot of interest as people think about what's the right way to deliver care now and also set themselves up for the future. Thank you, Linda. And Chris, looking forward, what are some final tips and thoughts that you would like to share with our audience today?
Well, first of all, I'd like to thank Linda. Linda is an amazing leader, and she's actually been a mentor to me. I've reached out to her a couple times, and she's always so willing to build other people up and to share information, and I really admire that about her. As I look forward, I recently bought the agency with my business partner, and what a month to buy the agency. We go right into earthquakes and COVID. It's a little rocky start for the first, but one of the first things we did is we put into place a profit share for our employees. We really feel like everybody is a part of the team. Everybody plays a role. Home care is not a solo event. It takes an entire team. So the first thing we rolled out to our team was a profit share program for every member. And it doesn't matter what position they are, they will receive the same amount as someone else in the team. And you know, it's based on full-time and part-time. They'll be paraded and all that jazz. But we felt that was so incredibly important to live up to, put our money where our mouth is. If we believe that we're a team, then we need to be able to share in the benefits for it. Looking forward, telehealth is where it's at. I too have been following the conversations at CMS and all of the updates. I understand why it has not been part of the emergency reimbursement package plans. I get it. It has to do with how it's billed. But I do believe that there's a future for telehealth and having that platform out there. I do believe that someday it will be part of the benefit. I think it might be many years, but I think that this is the opportunity to show the value of it and be able to effectively deliver a effective cost care that is patient satisfaction. It has that driver, so patients are really, really happy, satisfied, and having great quality of care. I think that this is where it's at. And as I talk to my team about, let's look to the future, we've got to get through this, but it's really, let's look to the future and what does this mean and how can we infuse this into our culture as well. Our nurses and our frontline staff are so important, and protecting them through this COVID. I see telehealth as a great way to protect them as part of our infection control plan. And it's part of making sure patients are comfortable and feeling like they're being watched over too, especially a lot of our patients who can no longer get out because of the, shelter in place orders. It is the best way to be able to connect with your patients, sending out quick messages, updates to keep them safe. I think all of it is part of where the future needs to go.
Great. Thank you, Chris. And thank you, Linda, for inspiring all of us by your experiences and your insights regarding this very timely topic in home health care. It truly is, one of those odd situations where time is of the essence to make sure that agencies continue to act quickly and act responsibly by supporting the patient community, especially with the expected surge of patients with COVID in the homes, and making sure that they're able to be in the community. And as one of our clients said, if you can't be there physically, now with Cinzy, you can be there virtually to continue caring for them in a very critical and compassionate manner. Today's session was sponsored by Cinzy. And if you have any questions, please feel free to use the Q&A platform tool in this webinar, and we'll address them at the end of this webinar or follow up with you directly. A little bit about Cinzy. We are a HIPAA-compliant virtual care platform with telehealth apps that enable your staff to use video, secure messaging, text, and email for clinician to clinician and clinician to patient communications. Throughout the episode of Care, Cinzy's video is used by clinicians to engage patients in virtual visits and virtual check-ins, and multiple participants can be brought into the video call, including specialists, family caregivers, and even a medically certified interpreter. These touch points are extremely critical during the coronavirus pandemic, as patients may be denying in-person visits or quarantine, staying in place, or practicing social distancing. Also, your agencies are probably experiencing the unfortunate situation that nursing facilities are increasingly restricting visits from your staff. So with video-based virtual visit functionality, you can ensure that your patients, wherever they are, continue to receive your organization's care and support. Your agency can also use Cinzy to drive patient engagement by sending out critical COVID-19 updates and self-care tips, scheduling and pushing out a cascade of condition-specific messages. These additional touch points are proven to increase adherence, reduce the risk of readmissions, and enhance satisfaction for patient and staff. And also, the platform can be used to conduct a coronavirus risk assessment to obtain information, manage care for at-risk patients. Please visit Cinzy.com to learn how to safely continue delivering valuable care and minimize the risk of infection and timing in the home during this time. If there are no questions immediately today, please feel free to follow up with me directly. I'll make sure that, especially if you have something specific for Chris's situation or Linda's situation, I'll reach out to them on your behalf with your question. Again, what I do want to do is thank Linda and Chris for their time, their energy, their inspiration, and their experiences today. We obviously planned this webinar a few weeks before this pandemic, and it was all supposed to be about PDGM. And right now it's COVID-19, but we also know that PDGM is also kind of hanging over all of us at the same time. And they have been instrumental in making sure that we had just a terrific content that we could share with you today, and also that it was very timely and relevant to the situations that all of you face today. I want to thank you for your time and your interest, everyone. Please be safe and be well. Thank you.